Hello friends, welcome to Pharma Tutor. Today we'll discuss about celiac disease. We'll discuss what is celiac disease, what are its causes, symptoms, diagnosis and treatment. So, let's begin our discussion. So, what is celiac disease? It is an autoimmune disorder which is triggered when we eat gluten. Gluten क्या है? Gluten is a protein which is found in different grains like wheat, barley, etc., which triggers an immune response resulting in damage of small intestine. So, this is an autoimmune disorder which affects our digestive system. It damages our small intestine and it can strike at any age, means it is not limited to a certain age group, but it can strike at any age and even in people who have tested negative for this disease. So, this disease is also known as celiac sprue, non-tropical sprue, or gluten sensitive enteropathy. We'll call it as gluten sensitive enteropathy because it is a gluten sensitive disease. It is caused due to gluten, triggered due to gluten, and it damages our enteric system. Enteric system means digestive system or small intestine is affected due to this disease. So now what is gluten? As I already told, it is a protein which is found in wheat, barley, rye and other grains. The property of this protein is it makes our dough elastic. We can see our bread is spongy, elastic. So what is the function of gluten? It acts like a binder. It acts like a binder, it holds the food together and it gives a stretchy nature, stretchy quality. You can see a pizza bread. Uh, Pizza bread is very stretchy. We can easily toss it. The ball of dough of pizza bread is stretchy in nature, elastic in nature. It is due to the presence of gluten. Without gluten, the dough would drip easily. It would break easily. So, this is the property of gluten which makes the food elastic and stretchy in nature. So, what actually happens when someone eats gluten? As you can see in the following picture, this girl is eating a slice of bread. Bread contains gluten. Okay. So, when a person with celiac disease eats gluten, what actually happens? These undigested gluten particles they reach to the small intestine. Okay, they finally end up in the small intestine for absorption. As you can see in the middle figure, these are some finger like projections which are present in our intestine. These finger like projections are called villi. Their role is absorption of nutrients. Okay, so they absorb nutrients from food. But what happens when someone eats gluten? These gluten reaches to the villi and they gets attached. Okay, these villi contain some microcells called enterocytes. These cells are on the surface of the villi which mainly plays role in absorption of nutrients. Now if gluten will come and it will get stick to these enterocytes, so how will absorption takes place? So absorption of nutrients will decrease. Okay, so now no our absorption of nutrients will decrease. Something wrong has happened. Then these enterocytes will trigger a chemical response and they will send it to the immune system of our body that something is wrong, someone has attacked us. Okay, so अपना इम्यून सिस्टम क्या करेगा भाई? अपनी आर्मी जो है वो हमारे आउटसाइड से जो हमारा एक एनिमी आया है दिस विल अटैक. ओके, सो दिस सिग्नल received by immune system cell will give the message go and attack these enterocytes, go and damage these enterocytes. Then what will happen? If enterocytes will get damaged by our own immune system, the absorption of nutrients will slowly decrease. It will slowly damage our means it will damage our small intestine. When small intestine will damage, digestion will affect. It will affect the whole digestive system. Okay, so this is why it is called an autoimmune disorder, because our own immune system is attacking our cells, and it is a chronic digestive system because it is damaging the small intestine, which further plays role in absorption of nutrients. If intestine is damaged, absorption will be decreased, the health of person will decrease automatically, several symptoms will be caused which will affect the overall health of the patient. So what are the risk modifiers of this disease? First is family history. If any member of your family is affected with this disease, then there are higher chances of contracting this disease. For example, if a parent is already affected with this disease, then there are higher risk that their children, their siblings can be affected. Okay, so this can be due to family history. Another reason is the presence of two genes, that is HLA-DQ2 and HLA-DQ8 gene. It is found that HLA-DQ2 gene is found in 95% celiac patients, whereas the remaining 5% have HLA-DQ8 gene. But it doesn't mean that if you have either of these genes, then you are affected with this celiac disease. मीन्स अगर आपकी बॉडी में इसमें से कोई भी एक जीन है तो इट डजेंट मीन कि आपको भी सीलियाक डिजीज़ होगी. इट जस्ट मीन्स कि आप हायर रिस्क में हैं, मीन्स यू आर हाईली प्रोन कि आप कॉन्ट्रैक्ट कर सकते हैं ये डिज़ीज़, आपको हो सकता है, हायर रिस्क है, चांसेस हैं. सो अनदर रीज़न इज़ any other genetic disorder or autoimmune disorder. If a person is affected with any other disorder like rheumatoid arthritis or type 1 diabetes or any other genetic disorder, for example Down syndrome, so such patients are highly prone to such disease, to celiac disease. Okay, next, symptoms of celiac disease. Celiac disease causes abdominal pain. As we know, it affects our digestive system, so it causes abdominal pain, anemia, loss of RBC, bloating, a feeling of fullness, stomach discomfort, constipation, diarrhea, nausea. It leads to weakness, so absorption of nutrients will be reduced, thus it will lead to weakness which results in headache, fatigue. It will result in pale. Poop color will be pale and it will smell especially very bad. Foul smell will be there and it will float. A condition will be caused steatorrhea, in which an excess amount of fat will also be excreted along with the poop. Means as we know, absorption will be reduced, so fat absorption will also be affected. Complications of celiac disease. In serious cases, celiac disease can result in cancer of intestine. It can cause intestinal lymphoma and small bowel cancer. It will also damage tooth enamel. We know the enamel is the protective part of our teeth. It is a top layer of our teeth. It will be also damaged due to celiac disease. It can cause infertility and lead to miscarriage in women. Celiac disease results in lactose intolerance. The patient won't be able to digest lactose containing foods like milk, curd, etc. As you know, the digestion will be affected, absorption of nutrients will be reduced. It will then lead to malnutrition, weakness, malnutrition will be caused. Overall, whole digestive system will be slowly affected, which will lead to damage of pancreas, which will lead to pancreatic disease. It will cause weakness in bones, which may lead to osteoporosis. Diagnosis of celiac disease. Different tests can be performed to identify if patient is suffering from celiac disease. First is serology test. Serologic test can be done to check for certain antibodies, like immune system is affected or not. Blood test can be done to check other parts of our immune system. Intestinal fatty acid binding protein test will help us to know whether our intestine is damaged or not. C reactive protein test will help us know if there is any kind of inflammation. Metabolic panel test liver and our kidney function. These tests will help us to know the quality of our liver and kidney function. Vitamin D, B12 and folate test will help us to know if there is any kind of vitamin deficiency. A complete CBC count will help us to know if the patient is suffering from anemia or not. Iron and ferritin test will help us to find out if there is any kind of iron deficiency. There is also a test in which the patient swallow a small camera, which help us to get images of our digestive tract, whether the intestine is damaged, what is the thickening layer of wall, and if there is any change in blood vessels. So these imaging tests help us to clearly identify any kind of disorder in our digestive tract. Genetic testing help us to look for human leukocyte antigens, which are mainly responsible for celiac disease. Treatment of celiac disease. Currently in pharma market there are no drugs available for the treatment of celiac disease. Only option is to have a gluten free diet. Means your food should not contain gluten rich grains. Different options are available in which contains gluten free starches. Examples are rice, corn, maize, soy, potato, tapioca, beans, sorghum, quinoa, millet, amaranth, flax seeds, chia seeds, nuts, flours. So these grains does not include gluten and you can easily have them in your meal to avoid gluten sensitive enteropathy. Other foods which are also always gluten free are fruits. Fruits are free of gluten, and vegetables, meat, poultry, fish, other seafoods, dairy items, beans and nuts. These are always gluten free and you can easily have them in your meal. So that's all about celiac disease. Thanks for watching. If you like this video, please hit the like button, share this video with your friends, and don't forget to subscribe and turn on the notifications to never miss an update from Pharma Tutor. You can also post your comments in case of any doubt. Thanks for watching.